Lecture on adult ADD. It's important for us to talk about adult attention deficit because it does present differently than it does as a child. Now, the caveat to that is that they had to have symptoms before the age of 12. So basically when we're talking about this, we're talking about someone who was on medication when they were younger and discontinued it and now realized that the problem is still there and that they continue to need their medications. Or, we're dealing with an age group in which nobody really knew about ADD when they were growing up. And now that they're starting to recognize the symptoms, lots of times it'll happen in one of their children or maybe even a grandchild. And they'll realize that, hey, I have those similar problems and I wonder if these types of medications or etc. could help me. So that's going to be kind of the presentation. According to the DSM criteria, attention deficit hyperactivity disorder is characterized by symptoms of impulsivity, inattention, and hyperactivity that emerge in childhood. So sometime before the age of 12. Initially, we thought ADHD was just a childhood disorder. And now that we know between 40 and 60% of children with ADHD have the disorder on into adulthood. It's going to present a little bit differently in adults. There's going to be less symptoms of hyperactivity and maybe more symptoms of inattention. Epidemiology, recent research has shown that somewhere between 3 and 6% of adults age 18 to 44 met criteria for ADHD or ADD. Now in childhood, the ratio of boys to girls is somewhere like 4 to 1. And so this kind of switches, and this is kind of how it does switch with adults. Is that boys are much more likely to be hyperactive and girls are much more likely to have inattention. So as you can imagine, when you're in a classroom, the boys who are very hyperactive and disruptive and making a lot of fuss in class are much more likely to be diagnosed than is a little girl who's sitting there maybe not paying attention at all but not disrupting the class. So it's much easier to ignore her. And that's kind of how that ratio plays out as far as diagnosis in childhood, we think, anyway. Now, when it gets to be an adult, it's more likely 1 to 1. And this is why. Is because the hyperactivity in adults mostly goes to like an inner restlessness. A lot of the hyperactivity symptoms go away. The inattention, however, kind of stays with you. And it causes a lot more disruption because symptoms of inattention in an adult really starts to interfere with lots of parts of their life, like keeping appointments, meeting deadlines, focusing, all of those things, frequent job changes, unemployment, all of those things really are more disruptive to an adult than, restlessness or a little hyperactivity tends to be. When it comes to the pathophysiology of ADHD, we know that genetics does play a really strong role, and we do know that often it comes from the mother's side. Now, there have only been a few genes associated with ADHD that have been identified at this point, and that leads us to realize that there are a lot of unidentified common things that may play a role. Some of the things that they have really looked at are observational studies in which the risk of ADHD is doubled or tripled among offspring of mothers who smoke during pregnancy, among persons with evidence of lead exposure in childhood, persons with obesity or diabetes, and those whose mother had these conditions during pregnancy. also have an increased risk. So there's a lot of environmental interactions once you have the genetic component as well. They are now doing lots of brain imaging studies in persons with ADHD, and they have identified dysfunction of dopamine pathways. Now, these dopamine pathways are involved in attention, executive function, motivation, and reward, as well as dysfunction in noradrenergic pathways, particularly those that are involved with the prefrontal cortex. We know that most of the stimulant medications that are effective for ADHD enhance dopaminergic and noradrenergic signaling, and that provides for support for the involvement of these neurotransmitters. So this is the diagnosis criteria, and we get this from the DSM-V. ADHD consists of a pattern of behavior that's present in multiple settings and gives rise to difficulties with social and academic or work performance. The diagnosis requires evidence of inattention, hyperactivity, and impulsivity, or both. Now, usually there's 6 or more of the following symptoms when it comes to inattention, but there are 5 or more in adolescents and adults, so for us it's going to be 5. And these symptoms have persisted for at least 6 months to a degree that's inconsistent with a person's developmental level and that directly affects social and academic or occupational activities. So let's talk first about inattention. Often fails to give close attention to details and makes careless mistakes in work or schoolwork or during other activities. Work is often inaccurate. Often has difficulty sustaining attention in task or play activities, remaining focused, like during lectures, like this lecture, or conversations, or when having to read like really lengthy writings. Often doesn't seem to listen when spoken to directly, kind of their mind seems elsewhere, or they're, obviously distracted. They often don't follow through with instructions, fail to finish work duties, things that especially that they do not like to do. And they're easily sidetracked. So they start a lot of things, but they don't necessarily finish. They often have difficulty organizing tasks and activities, managing things that need to go in sequence, like this needs to come first, this needs to come second, those sorts of things. Their workspace tends to be like really disorganized, messy, and they often don't meet deadlines. They often avoid or dislike or are very reluctant to engage in tasks that require sustained mental effort. So if it's something they really don't want to read, say for example, they have a really hard time with it. They often lose things necessarily for tasks or activities, and that can be wallets, keys, paperwork, phones, glasses. They're constantly looking for something. They're easily distracted by other stimuli. So it's hard to for them to work, and if the TV's on in the room and that sort of thing. They're often forgetful in daily activities. So these are the people who forget to pay the phone bill and it gets cut off, and then they forget to pay the electricity and then it gets cut off. So this inattention stuff, especially for adults, is very bothersome for them. Now, when it comes to the hyperactivity and impulsivity, this tends to be different for adults in that they're able to kind of take this in hand and they kind of internalize it. So lots of times they feel really restless inside, like they're not doing, what they're supposed to be doing, or that they're not measuring up to, the person that they know they could be if they could just kind of get this stuff under control. So again, 5 or more of the following, since we're dealing with adults and talking about hyperactivity at this point. Often fidgets with, taps hands or feet, squirms in seat, leaves seat in situations that's inappropriate, like a work office meeting. They run about or climb in situations. Again, this is different for adults in that they're just going to feel really restless. Often unable to play or engage in leisure activities quietly. The people that don't like to be alone, they like noise, so they come in and turn on the TVs, turn on the radio or whatever, but they want to have kind of that noise going in the background. They're often on the go. They act as if driven by a motor. talk excessively, often interrupt people, complete sentences for people, kind of hog the conversation, I guess you would say. They have a lot of difficulty waiting turns in line. They interrupt or intrude on others, and this is like back to the whole conversation thing. So sometimes socially they can be really awkward. Symptoms that cause impairment. Several symptoms of inattention or hyperactivity and impulsivity were present before the age of 12, and we've said that a couple times. Criteria for this disorder are met in 2 or more settings. So home, school, work, friends, relatives. You know, I mean, if it's excessively interfering with their work, then, you know, that's something that's going to need to be treated for sure. There's clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational functioning, which is kind of what I was just saying. Symptoms do not occur exclusively with any other psychiatric disorder. And the current presentation is usually combined. So they meet the criteria for both inattention and hyperactivity, and it's been present for the past 6 months. So they used to give a real emphasis on, you know, there are 3 different kinds. They're mixed, there's hyperactivity predominant, there's inattention predominant. They're getting away from that a little bit because they realize that when you have this, that you may act differently in different settings. And so you have a little bit of this and a little bit of that, and so they're kind of getting away from which one is kind of predominant at this point. So this is your criteria for your diagnosis. There are lots of scales that are available to help with this diagnosis, and these are the things that they're looking for within the scales to diagnose adults. So when it comes to subjective information, you know, most of the time they're going to come in with a pretty good idea, I guess, of this is going on. And it could be that they were treated as a child, or like I said, they have a child who's now being treated and they've started to kind of recognize those things in themselves. Sometimes it's a sibling who's gotten treatment, and then that kind of sparks everyone in the family to talk about things, and it kind of starts to come out in the open. When it comes to subjective, there are a lot of behavior rating scales that you can use. Probably the one that I'm most familiar with is the adult ADHD self-report scale. You could do that in the office. The other thing that you want to make sure that you do when you're in this particular situation is that you want to rule out or be aware of at least common co-occurrence of psychiatric conditions. So you have to think about substance use disorders, and remember, lots of times, you know, people are compensating with substance abuse or substance use. So it's definitely something that you want to ask them about. Generalized anxiety disorder, you know, if that's a co-occurrence with this ADHD or ADD and you give a stimulant, you know, it could make the situation much worse. So you need to be aware of that. Other mood disorders that's probably really, really common with this is depression. And we really don't know if it's a chicken or the egg, or this is just a comorbidity. But lots of times people feel like that they haven't accomplished what they're able to accomplish, or they just, you know, the constant struggle of every day just causes that depression. But it's something that you definitely need to be aware of. You want to think about bipolar as well. Thyroid disease, you know, the things that we usually, the type of workup that we do for depression, you know, those common things. You know, as always, you have to let your diagnostics be driven by your subjective and objective data. So just be aware of, to ask the right questions and to think about the things that could be causing a underlying condition for this. Objective data. I know I put rating scales in subjective data because it's a lot of the questions that you need to ask, but a rating scale is also an objective measure. You know, if you do the rating scale and then you treat with medications, you're probably going to want to start low, and then you want to increase your medication to get rid of as many symptoms as possible, but at the same time, not increase your side effects from your particular medication. So using your rating scales really helps you know where you started and where you are now and where you want to go. So they're an objective measure as well. They can also be a diagnostic measure. So sometimes students get this really confused. Is it subjective? Is it objective? Is it a diagnostic? It's kind of all those things at the same time. Now, when it comes to physical exam, you want to do the normal physical exam. When it's an adult, you have a little bit more to worry about. You want to know if there's cardiac risk factors there, and you could consider at least doing an EKG before you do any type of stimulant. We do know that it's going to raise the heart rate slightly, probably as much as like 5 beats, and it's going to raise the blood pressure a little bit as well, especially if you're giving short release as opposed to extended. So, if your patient is a really high risk, then, consider doing a workup before. But for the most part, there's no objective workup needed before you start stimulants. When it comes to differential diagnosis for adults, there's actually less than there are with children. And that's because you can, get a pretty good history going, and you have your self-rating scales and a detailed history, and so you have a lot of life kind of behind you to point to specific diagnosis. But your differentials definitely common comorbid mental health issues, anxiety, depression, consider bipolar, those sorts of things you definitely want to take into consideration. And please be aware that just because you diagnose ADHD doesn't mean that you don't also have depression or also have anxiety. So, those are all things that you need to be aware of, and a pretty good reason why that you should do a referral to a mental health specialist, just to make sure that you are covering all the bases and that you are, holistically treating the patient and not just zooming in on this is what they have and this is what I'm going to treat. The other thing that you have to be concerned about, of course, is the fact that they may be getting the medications not for themselves but to sell, or maybe getting it for themselves when they don't actually have this type of problem. So it's always something that you have to think about. I don't want it to be like top in your mind, but it is something that you need to consider. When it comes to treatment, always think about therapy. Uh, do a referral from primary care. Make sure that you're not missing anything. Make sure that the treatment that you're giving is appropriate. And then if you want to treat them in primary care, just make sure that you're knowledgeable about the medications and adherence, and that you can provide that holistic care that they need in primary care. Remember that it is scheduled if you do medications, so that's something that you have to keep in mind as well, depending on where you're working. The pharmacologic treatment usually involves stimulant medications. There's a non-stimulant, probably the most well-known is Strattera, that may or may not work. And also you have to worry a little bit about increased heart rate or problems if they have any cardiac issues. So the same with the stimulants. These are always things that you want to consider. The big thing about the stimulants, there's lots of different things out there. There's generic, there's newer stuff, there's patches, there's short acting and long acting medications. Most of the sources that you see on treatment for adult ADHD recommend not the short term, but more the intermediate or long acting. That has a lot to do with compliance. It's really hard to take a medication 3 or 4 times a day, and people are much more likely to be compliant with the long-term medications. So what you want to do is work with your particular patient and what works best for them, and what helps them with treatment.